the Maryland Department of Health and Mental Hygiene, Hospital Breastfeeding Policy, Maternity Staff Training Program, Supporting the Mother Who Feeds with Bottles and/or Infant Formula, Session 9. Objectives. During this session, we will identify teaching points to include when educating or counseling parents who are using bottles and/or formula. It is our responsibility to assure that those who are not breastfeeding are prepared to feed their infants in a safe manner and can appropriately determine the amount of feeding necessary to meet the baby's needs. Many people make the determination about how they will feed a child before they even become pregnant. While pediatric healthcare providers have a great deal of knowledge about various options available, most people learn about infant formula through advertisements on TV or in magazines. In addition, once women begin prenatal care or acquiring items for their future babies, they begin to receive mail that directly markets infant formula. Counseling regarding the formula choice is best left to pediatric healthcare providers. Pediatricians, nurses, and dietitians are all informed about various products and have no incentive regarding the choice that the patient makes. The priority for healthcare providers is choosing a feeding that will promote health and ultimately result in appropriate growth and maturation. People cannot make an informed decision if they don't have education about their choices. It's therefore important that we provide information to non-breastfeeding families about infant formula recommendations. Health benefits of breastfeeding aside, there are issues that come up periodically with infant formula that most people aren't aware of unless the problem occurs while they're formula feeding a child. Families need to be aware that powdered infant formula, unlike ready-to-use or liquid concentrate, is not sterile. During the manufacturing process, liquids can be heated to the desired temperature for sterilization to occur. This is not true of powdered formula. Formulas can inadvertently become mislabeled or contaminated. Recalls result. Infant formulas, while appearing to be nutritionally complete, are updated periodically to include a new nutrient that we didn't realize they should contain. Families need to know that safety issues periodically do occur. As healthcare providers, we need to be cognizant to individualize counseling about the variety of infant formulas available based on the medical need of the specific infant. In the business of health, we should be aware to suggest products based on need and validity of claims. New mothers are tired and may not take time to read label instructions. It is best to provide verbal instruction to assure that they have the knowledge to carry out formula feeding properly. Whether the product is sterile at purchase or not, handling and storage directly affects safety, just like with any other food. New parents need information on how to properly prepare formula so that it becomes or remains sterile when fed to young babies. They need to know how to safely store formula so that the infant does not inadvertently become ill as a result of improper handling or storage. As reported in the journal Pediatrics, 77% of U.S. formula feeding mothers did not receive instruction from a health professional regarding formula preparation. 73% were not instructed on safe storage of prepared formula. 30% did not read the safe use instructions on the package, and 38% thought that both powdered infant formula and ready-to-feed were unlikely to contain germs and were both sterile products. Healthcare providers should understand safe formula preparation and handling so they can teach parents proper techniques for reconstituting and storing infant formula in order to minimize the risk of infection. Baby-friendly certification requires this be done individually for each family that uses formula and not in a group discussion. Parents need to be taught that powdered infant formula is not sterile and that pathogens may be present that could harm their infants. Risk of harm and serious illness decreases with proper preparation and storage. Written materials should provide the safe preparation and handling of infant formula along with one-on-one verbal explanation to the parents. Hand washing is paramount for safe preparation and handling. Parents need to be informed that before rinsing, The hands must be well lathered and rubbed together for at least 20 seconds. Explanation about proper mixing of infant formula should only be provided to mothers of formula-fed infants. That should then be followed by questions to assess their understanding of the education provided. Proper sterilization of water and feeding equipment should be highlighted. Prior to preparation, all feeding and preparation equipment must be washed with hot, soapy water. Cleaning removes some bacteria. Sterilization involves heating a material to boiling or higher to ensure killing of all remaining microorganisms and their spores. All cleaned equipment should be completely submerged in the water. The pot should then be covered and the water brought to a rolling boil and allowed to gently boil for 5 minutes. Allow to cool before handling. Feeding bottle sets should be assembled to prevent contamination of the inside of the bottle and both the inside and outside of the nipple. Water should be sterilized by placing more than the required amount of cold tap water in a clean pot. As the water boils, some will be lost as steam, so the amount must be remeasured prior to mixing. Once the water comes to a rolling boil, the heat should be turned off and the pot covered. Powdered formula is not sterile like concentrate or ready-to-feed formulas and can contain bacteria that could make babies sick. The water used to mix the powdered formula should be at least 158 degrees Fahrenheit to help kill most of the bacteria as recommended by the Centers for Disease Control and the World Health Organization. Once the formula is mixed, allow the formula to cool before feeding. To cool quickly, place the bottle under cold running water or in ice water, but be sure to keep the water below the ring on the bottle. Bottled infant waters that can be purchased at the store are not sterile and should not be used to mix infant formula unless sterilized first. Tap water is recommended for mixing infant formulas, as it often contains fluoride, which is necessary for the infant and not present in infant formula. Bottled water may also be used, yet is not necessary unless a family has contaminated water or well water with a high nitrate level. If using well water, it should be tested to assure that the nitrate level is safe. Baby waters are an unnecessary expense. Softened tap water is high in sodium and should not be used. Filtered water may contain bacteria and should not be used. Mineral water is high in sodium and some minerals, so it should also be avoided. Distilled water contains no minerals and should not be used. Carbonated water is not appropriate, therefore should not be chosen to mix infant formula. Germs can be present on can lids, so parents should be taught to clean the top of the can and lip with hot soapy water, rinse, then dry with a clean paper towel. Whether using powder or liquid concentrate, parents need to know proper ratios of formula and water to reconstitute safely. Adding too much water will not provide sufficient nutrition for the infant. Adding too little water can provide inappropriate amounts of micronutrients, especially electrolytes, which in turn could cause harm. Powdered formula, once opened, lasts longer and when prepared can be mixed in smaller amounts. If a mother is breastfeeding and only using some formula, powdered formula can be mixed as needed. Concentrate and ready-to-feed formula must be used or discarded more quickly, within 48 hours for concentrate and 24 hours for ready-to-use. Liquid concentrate and ready-to-feed is safer for infants to consume because it comes already sterile and the risk of bacterial contaminant is reduced. However, make sure parents are aware that formula recalls for contamination can and have occurred in the United States. Once formula is prepared, if not using immediately, place it in the refrigerator for safe storage. It is recommended that formula be prepared immediately prior to use, and any unused formula from that feeding be discarded immediately after feeding or within 1 hour. When prepared formula will not be used immediately, product prepared from powder should be refrigerated no longer than 24 hours. Formula prepared from liquid concentrate, per formula company instructions, can be refrigerated up to 48 hours. When placing in the refrigerator, formula should be stored in the back, further away from the door, as temperatures near the door are more likely to fluctuate as a result of the door being opened periodically. Refrigerator temperatures should be kept at 39 degrees Fahrenheit or below for formula or breast milk storage. Remove from the refrigerator immediately and rewarm for no more than 15 minutes. Longer periods at warming temperatures foster bacterial growth. To ensure even heating, shake or swirl periodically. Discard any rewarmed formula if not consumed within 1 hour. Formula temperature can be easily tested prior to use by turning the bottle upside down to allow a drop or two of formula to fall on your wrist or the back of your hand. The formula should feel lukewarm, not hot. It is important to teach that bottles should never be warmed in the microwave. The formula heats unevenly, creating hot spots that could burn a baby's mouth. Prepared feeding should always be stored with an ice pack when on the go. Formula should never be left at room temperature for more than half an hour. Many mothers pack bottles of prepared formula in an insulated bag or cooler with an ice pack. If formula will not be consumed within 1 hour of preparation, it should be refrigerated and reheated at the destination. Unless it has been refrigerated, any feeding not consumed within 1 hour of when it was prepared should be discarded. All leftover formula should also be discarded. The discussion for parents who are feeding with bottles also must include basics of safety strategies of bottle feeding. First and foremost, parents need to know that they should never prop a bottle, as babies can choke, overfeed, and have other feeding issues. Feeding time is a time when the caregiver must be attuned to the baby and aware of his reactions. Babies communicate to us even when being held during a feeding. Babies will show us through facial expressions and body language what they are feeling. Babies' tummies are small, about the size of a walnut shell. Thus, parents need to be guided as to what a realistic feeding volume should be. Recommend they start small, with 1 to 2 ounces per feed. The caregiver can always add more to the bottle if a baby consumes the amount given very quickly and indicates he would like more. Parents also need to be taught the baby behaviors that communicate that the baby has had enough. Babies often do this by turning their faces away from the bottle or pushing a bottle away. Parents should stop at this time rather than trying to give a little more. The baby will have an opportunity to feed again in a few hours. Babies cry for many reasons. Sometimes this cry is because they are hungry, yet many times it means other things. It is important to let the new parent know that a baby cry could also mean that the baby is hot, cold, wet, dry, needs attention, wants to be put down, is tired, etc. It is important for parents to address other issues in response to a crying baby rather than assume that the cry always means hunger. It is important that all new mothers are discharged with the information they need to know to care for their new babies. Giving appropriate information about formula preparation and infant feeding practices to mothers who are not breastfeeding helps them know how to care for their new babies after leaving the hospital.